Turn to an important health alert about some very popular over-the-counter drugs and pregnancy. The FDA is issuing a new warning against using common pain and fever medications like Advil and Aleve in the second half of pregnancy. And of course, Dr. Ashton, she is here to break all of this down for us. Good morning, friend. Let's just dive right in because we're talking about some pretty popular pain medications. Like we just said, they're Advil, over-the-counter stuff. What's new here?
Well, Cecilia, this is an FDA drug safety communication that will result in label changes about possible, even though they're rare, risks when used in pregnancy. And again, you talked about this class of medication. It's used for fever, pain, over the counter, by prescription. In obstetrics, we have known that there should be caution when using these medications in pregnancy for decades. This is really an FDA awareness alert for pregnant women themselves and other healthcare professionals.
Yeah, you were telling me this is something that OBs have been basically not telling patients not to take for a long time now. So what's the biggest concern now out of this research?
Well, it's all about timing in pregnancy, Cecilia. When used after 20 weeks, which is the midway point in pregnancy, these drugs can cause a rare but serious side effect in the fetus that affects the fetal kidneys and then therefore results in low amniotic fluid. It can also affect one of the major fetal arteries. But I want to bring up that we do use this class of medication in obstetrics in the second and third trimester sometimes to treat preterm labor. So it's all about weighing the benefits versus the risks and using it under medical supervision.
So if you have a patient who comes to you and may have wanted to reach for one of these drugs because they're suffering from some kind of ailment, what do you tell them to do?
This is probably the most common call any obstetrician or midwife gets. Can I take this particular medication for pain, for fever, in pregnancy? Acetaminophen or Tylenol, generally safe. Other than that, you absolutely want to check with your obstetrician or midwife.
Dr. Ashton, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.